Welcome back. I'm joined by Christina Hamilton, Iowa Advocacy Director for the American Lung Association. Now, Christina, we want to talk about this report that came out. And tell me a little bit about, with lung cancer, where does the state of Iowa lie in terms of where we are at?
Well, this is our seventh annual State of Lung Cancer report that the American Lung Association has released. And we found that Iowa can improve in new cases of lung cancer. Unfortunately, the rate is above what the national average is at 61.2 people per 100,000. The national average is around 53. Iowa can also improve in the 5-year survival rate. The good news nationally, we've seen the survival rate improve by 26% over the last 5 years. But unfortunately, the survival rate in Iowa is lower than the national average at 26.3% of people surviving lung cancer after 5 years. And then finally, for surgery, Iowa can also improve there. About 17.7% of Iowans get surgery when they're diagnosed with lung cancer. The national rate is 20.7, and surgery is a common way that lung cancer can be treated. So we would like to see those rates increase.
And tell me a little bit about, in your opinion and your expertise, what do you think is a contributing factor to those numbers?
Well, tobacco use or cigarette smoking specifically is still the leading cause of preventable death and a leading cause of lung cancer. So we really want to see some policy changes around cigarettes, specifically around increasing the cigarette tax, which hasn't been increased since 2007. So it's a very long time. Obviously, costs have changed since then. So we'd like to see the cigarette tax increase so that we can start to chip away at the smoking rate amongst adults in Iowa, which is currently higher than the national average at 14.7%. And then also radon. There are more policies that we can pass to protect people from radon, which is an odorless, colorless gas that's naturally occurring from the ground and gets captured in buildings. Iowa has one of the worst rates of radon. It's pervasive throughout the state. So we would also like to see some policy changes around radon to protect people from that exposure.
Can you talk to me a little bit about biomarker testing?
Yeah, so biomarker testing is sometimes referred to as tumor or molecular or genetic testing, and it looks for changes in a person's tumor in the DNA of the tumor. And then once a biomarker is identified, then that can help determine what treatment options would be best for that individual patient. So fortunately in Iowa, Governor Reynolds signed House File 2668 into law on May 1st, and that will require Iowa insurance plans to cover biomarker testing. So this will have tremendous benefits for improving treatment for people with lung cancer and other chronic diseases.
And in terms of symptoms?
Well, symptoms definitely vary. Oftentimes, people with early stage lung cancer show no symptoms at all, unfortunately, because there are very few nerve endings in the lungs. However, those that do present symptoms may have a persistent cough that won't go away. If it's very serious, they could be coughing up blood. Sometimes there's sudden weight loss, loss of appetite. So if you are having persistent symptoms that are unexplainable, pain in the chest, things like that, then definitely talk to your healthcare provider to assess whether you need to be further screened. And certainly, if you have a high smoking history, if you smoked a pack of cigarettes a day approximately, and you're over the age of 50, definitely talk to your healthcare provider about lung cancer screening.
And just in wrapping, there's one thing that I want to clear up too, if you can touch on this also, is people could be diagnosed with lung cancer even if they've never smoked a day in their life.
Absolutely. I mentioned radon earlier, which is an odorless, colorless gas, and is the second leading cause of lung cancer. We also see other exposures that can be linked to lung cancer, such as air pollution, other environmental factors, occupational hazards, genetics, and family history. So there are other exposures that are linked to lung cancer. So again, if you're having some unexplained symptoms, they won't go away, please talk to your healthcare provider.
Wonderful. Christina, thank you so much. We really appreciate it. And thanks for breaking down those numbers for us.
Thank you for
Thank
having
you.
me.
Absolutely.